I want to move into something that warrants endless discussion these days, and it's been in the news way too much lately. So joining us now is our lovely in-house psychologist, Dr. Gail Saltz, here to discuss the psychology behind gun violence and the impact it's having on victims in the communities. Hi, Dr. Saltz.
Hello.
How are you?
You? Good.
Good. We were so happy you're joining us again. And, I want to start off. It's really funny. I was, funny is not the word, but I was actually supposed to leave from LAX Friday morning. My flight was at 11 on JetBlue. We're in the car. We're at the mouth of the airport, and traffic just stops. And I see all of a sudden helicopters. I'm thinking, what, is Obama in town? I'm thinking, what could possibly be holding us up? And then, of course, it was because there was a shooter in Terminal 3 at LAX. Going after these, TSA agents. It was really scary. But yeah. I want to ask you something. Can the mental health community well, let's start here before we go there. Why is this happening now? Is it because of, do you think, mental health community? Is it because gun rights and the law? Why recently are we seeing such, this in the news so much?
I think it's a confluence of events. Some of it is certainly due to a need for more awareness about mental health issues, more availability of treatment for mental health issues, better insurance coverage so that people can go get mental health care when they need it. But the reality is that a very small percentage of violence is committed by people who are seriously mentally ill. Is it higher than the average population? It is. But most extreme violence is committed by, if you look at the people, they are young men, they are angry, they're disenfranchised, they're alone, maybe they're somewhat paranoid, maybe they're abusing substances, but mostly they're angry and sort of out there alone. And unfortunately, they don't enter the mental health system, and they are able to get guns. They are not only able to get guns, they are able to get semi-automatic guns that can, kill many people in a very short period of time. So the omni-availability of high-powered weaponry is obviously also something to consider. And I think that the day and age that we're living in, which is not so much about severe mental illness, but the general angst and agita that people live with and don't feel like they have any place to go with, the economic stresses that we're living in, feeling that they don't have support systems so that they become disenfranchised and angry and feeling alone. So in that sense, I guess, as I relate it to mental health care, I would say we don't have preventive mental health care, right? We have, you have preventive every other kind of medical care. You have to go to your doctor for your checkup, you take your kid to the pediatrician for a checkup, and you do things ahead of time. But we don't do anything ahead of time to manage, let's say, people's emotional state. Hence, we are seeing tremendous bullying with terrible consequences, suicide.
Can I ask what that preventative mental health care would look like?
Yes, I think one feature would be more education about people's emotional state in schools and what children can do to, A, not stigmatize having an emotional state that doesn't feel good and saying, oh, you must be weak, something's wrong with you, but to be instead inclusive and build in who can you talk to, how can you support somebody like that. If you see something going on that's not okay, like bullying, and you're a bystander, what can you do to step in? Because we know that bystanders can make the biggest difference. How can you step in? We have to, basically what I'm talking about is teaching empathy. And social and emotional abilities, those things can be taught in schools, and we just don't prioritize them at all. And additionally, helping parents and adults also have outlets that have to do with where can they go, who can they turn to, who can they talk to. And of course, what does that mean? That means better coverage. Now, hopefully, Obamacare is now saying, yes, it's going to pay for mental health coverage for everybody. But we don't yet know what that means, how much, and how can we direct people toward the kind of care they might need.